our guest, it's our guest today, because Maria is on the podcast for the guest, is Sera Lavelle from New York. She is a licensed clinical psychologist in the state of New York. She holds a master's degree in psychology from NYU and a second master's and a PhD in clinical psychology from Derner Institute of Psychology. I hope I got that right, but you'll correct me.
Yep.
At Adelphi University. Her dissertation was on the effects of emotional and sexual betrayal on relationships. She's currently in clinical practice at New York Health Hypnosis and Integrative Therapy, using hypnosis and integrative therapy for emotional eating, eating disorders, anxiety, ADHD, infertility, and relationship issues. That's a lot, mouthful. So let's start there.
Okay.
The common layperson's vision of hypnosis is two things. It's the evil psychiatrist or psychologist holding up the clock and going back and forth and going, "You are getting very sleepy," with the European accent. Or it's the magical hypnosis psychologist or the magician performance guy on stage who has the lineup of people and they're making them sound like chickens. So debunk all of that stuff and tell us why what you do in hypnosis is real and all of that is a bunch of BS, and convince people that hypnosis is actually like real stuff.
Yeah, so it's really interesting. I was so glad that I wrote a paper on the history of hypnosis because it helped me understand where people got those ideas, right? I mean, hypnosis has been around forever. In fact, it wasn't just even Freud that started with it. It actually was a main form of helping people during surgeries, and the reason it got depopularized was because of the invention of ether. So you have hypnosis, which doesn't work 100% of the time, right? For something like having major surgery. However, it's not going to kill you either. But then you have something like ether that's, it is going to work. It's going to be very effective if somebody's getting surgery, but it does kill you every once in a while, right? So it's for a long history, it was medicalized and it went through different realms. Sometimes it went through a spiritual realm, and people would think, you think of like a mesmer and an animal magnetism. But then it moved on to Peisiger actually was the first person to go, "You're getting sleepy," and it was like more related to like somnambulism. And that idea of somnambulism is interesting, that before people even understood brainwaves, they felt like it was like a state of being sleepy. Whereas if you really look at brainwave activity, it is the hypnagogic state. So your brainwave activity is somewhere between a waking state and a sleeping state. A lot of inventors over the years would put themselves into a sleepy state. So while creating inventions, for instance, Edison was known for, and a lot of, at the time, were known for holding a ball in your hand while you're writing out your creative ideas, so that when it dropped, it would wake you up, right? So we've always known that kind of tapping into this like sleepy, unconscious state can be helpful. So there's kind of like that stereotype of it, that you're getting sleep. Going into the other one, it's stage hypnosis, is a term for, and kind of like more of a magic trick. That's a lot more about suggestibility. What's interesting about that stage hypnosis is the hypnosis is not making the people do things. People are doing them of their own accord. The hypnosis part is convincing them that they didn't. So if you were ever see kind of the stage hypnotist, the magician, they'll go through a huge screening process of finding the people most willing to convince themselves that they're not doing it on the ground, right? So the first thing you do is see what the hand is. Then you see this. Then you do a whole screening of like who's going to go along with this, right? And then it's a funny show. Now, clinical hypnotism, you kind of have to think of when it got into the realm of more mental health, because it used to be more, medical hypnosis. That really started with like the Brewers. And if you look at the whole field of psychoanalysis, Freud started out with hypnosis. And the story is he didn't continue with it because he was bad at it. So he tried to get to the unconscious in any way possible other than hypnosis. So dream interpretation, Freudian slips, free association, it's all these things that are kind of like hypnosis-like, but different. In our practice, we practice Ericksonian hypnosis, and most people who are therapists that do hypnosis do Ericksonian hypnosis, which is just it's a guided meditation, but guided in a very specific way to help you get into a relaxed state. And then you're saying things to help people think about it on a deeper level. There's nothing magical about it. Um, it's more that you are more receptive to what you really want, anyways, when you actually take the time to tap into that part of you to ask yourself what you really want. So you have somebody more guiding them.
Right. And I mean, I don't do hypnosis, but from what I remember learning, so I did take a hypnosis class back in graduate school. So the two things I remember is that one, kind of the saying that all hypnosis is self-hypnosis.
Yes. Perfect.
and then the other part is that with hypnosis, there's kind of like things that juxtapose one another in the induction.
Yes. Right. There are different kinds of induction techniques. And what we're saying when we say induction is what you're doing to help a person just get more relaxed. So when you really think about an induction, that's the part that's just very similar to meditation, right? So some people would do more something you'd call direct suggestion as opposed to indirect suggestion. Now, direct suggestion would be you are going to imagine yourself walking down the stairs. As I count down from 10, you're going deeper and deeper and deeper. Now, that'll work for a certain percentage of the population. However, a lot of people, so it's kind of like the more suggestible you are, the more you could use direct suggestion. The more kind of skeptical you are, or the more that you are like, no, I don't want to walk down the stairs. The more resistant you are, the more you do something called indirect suggestion. So indirect suggestion would be you're kind of disguising what you're saying. So an example that I give for that is, say I were to tell you right now, don't pay attention to anything I'm saying. It's not worth it. Make your mind relax. That would be direct suggestion. Half the people would go, okay, I'll listen to that. I'll make my alarm left. I'll stop listening to what she's saying. The other half would go, now I want to listen more. Like, why am I not supposed to listen? Right? And there's like that anxiety around it. So if I were to say something like instead, like, you don't want to train your mind to stay on track. It's not worth the trip. A lot of times you'll pick up on train, track, and trip, and you'll visualize a train when really I'm giving you the same message. You don't want to train your mind to stay on track. It's not worth it, right?
Right.
As I recall, Erickson is the stage guy, right?
So there's Milton Erickson and then there's Eric Erickson.
Different Erickson.
Different Erickson.
Oh,
That's okay.
Yeah.
Okay, see, that's the psychology part, right?
That's the psychology. Yeah.
Okay,
Exactly.
so there's two different Ericksons now.
Always have
there's
been.
a lot of Eric.
Yes.
There's a lot of Ericksons.
There's
but two
probably
main
many.
fields. Yeah. But what you're going to learn about
one
in
more
school,
like developmental stages and one more hypnosis.
many people are much more familiar with the developmental stages. Any Psych 101, you'll probably learn about Erickson in terms of the developmental stages.
Okay, so this is hypnosis Erickson.
This is hypnosis Erickson.
Okay, all right. Okay, so on your website, you mentioned that unconscious exposure, and I don't know if this is part of the hypnosis part, but unconscious exposure can have similar cure rates to real life exposure. Is that similar to like when people like close their eyes and imagine the thing that they're afraid of and like exposure therapy part?
Absolutely. So unrelated to hypnosis, I helped in graduate school with a study on unconscious exposure to phobias. And Joel Weinberg wasn't in hypnosis research in any ways, but he was into studying the unconscious. So what we would do in this study is we would flash subliminally a picture of a spider to the point, like while a person was playing a game on a computer. And they wouldn't notice that it was this huge picture of a spider. But we would do that to half the people. And then the other people, they'd be flashed something like letters or something neutral. And then we would bring them into a room next door and see how close they would get to a big tarantula. And what we were able to find in that study was the subliminal exposure actually made people approach more. So think about it. If you're going to do arachnophobia with a person and show them a real spider, you're going to have very high levels of anxiety, and people are likely to drop out of therapy. However, if you can do things subliminally and it has the same effects, it's going to be a lot more tolerable of an experience for your patient. They're going to stick with the therapy longer, and you're still going to get the same effects.
So that's basically subliminal messaging, is what you're saying.
Mm-hmm. Yeah, but any way to get into the unconscious, right? Without it being so direct.
So that's quite dangerous then. What I'm saying is that you're saying that subliminal suggestion is real.
But it's not suggestion, it's the ability to tolerate.
Right, in this circumstance, that's what it is. But essentially what you're saying is subliminal, like 1984 is real, right? Because that's...
Well, I mean, we get subliminal messaging all the time in everyday life. Mm-hmm. I mean, we're picking up on, even without the use of like trance or unconscious, in court cases, you can't do like a person could say, "Oh, I knew that person had a blue purse," and then the person could say, "What was she wearing when she was what was she doing when she was carrying her brown purse?" And then later they ask the person what color was her purse, they'll say brown. It's subliminal messaging happens all the time in everyday life. The ethics come in when you're telling a person, look, in therapy, we're doing this subliminally.
Right, but you don't. Right, but they're not. But you wouldn't necessarily let them know, because I think when there's exposure done unconsciously, there's less resistance, right? And I think that's the point.
Yeah. So I think, are you're afraid is like, if we flash somebody murder, go kill somebody. Is that going to make
no? It's not that. It's not that overt. What I'm saying is that I didn't necessarily think that this was going to go in this direction, but
let's just go wild with it.
No, but if you're sitting at home and you're watching like a football game, for instance, you're not necessarily being resistant, and then a political ad comes on.
Absolutely.
Instance, and they flash something in like unconsciously during that political ad.
Mm-hmm. Yeah. And
that's essentially suggestion.
Right.
They do all the time.
Right. So, I mean, do people, do we tend to accept things more when we're in a relaxed state?
We will listen to what's already congruent with us, right? So say a person comes in for smoking cessation. We don't do smoking cessation, but it's a tangible example. And we were to say, get more in touch with that part of you that wants to quit smoking. They would more be likely to get in touch with that part of themselves that wants to quit smoking than they would in a normal everyday life experience, right? However, if there is no part of them that wants to quit smoking, you can't make you're getting in touch with that part of yourself that wants it, right?
Mm-hmm. So if someone is bringing them in, if they're being coerced, it's not.
Yeah, okay. We won't accept patients who call and say, "Hey, could you hypnotize my husband to quit smoking?" And not because because we can make him do it when he doesn't want to, because we're like, that's just not going to work. So, if your husband calls us and decides he wants to do it, but we can't coerce him. So it's not that we're going to do something against his will. It's that you're going to waste your money.
See, you can't make me stop eating buffalo wings. That's what.
But maybe there's a small part of you that wants to. We'll find that part.
It's more if you're debating about it. If you're like, hey, I really love buffalo wings, but I want to eat them less often because it's contributing my weight. How can you help me do it less often? We might make you aware of both of your goals and asking, really questioning yourself. Which one is more important to me right now, my health goals or my the buffalo wings? And we definitely tell patients, look, you're not ready to change. You don't want to. And that's not a bad thing. Just accept that.
Speaking of which, same on the website, you mentioned that you help with disordered eating and eating disorders.
Yes.
And I get that a lot, being married to a psychologist and lifelong issues with food on my end. She tells me, because I do intermittent fasting, and it's actually helped me, to be honest, not cut down on calories, because that tends to be a thing, but at least be conscious of them. But she tells me a lot that I have disordered eating. Not an eating disorder, but disordered eating.
Yeah, it's a slippery
So tell me what the
slope.
difference is between disordered eating and an eating disorder.
A degree. So I think most people struggling with any kind of weight is you have the same mindset as a person with an eating disorder. But so for instance, say you binge and purge once a month, and you're literally binging and purging, you still don't qualify as bulimic. You're not doing it enough. But your mindset around food is restricting and then binging and then vomiting, right? So, it's if there's a mindset around I need to stop eating at certain times, start eating, so I'm not against intermittent fasting for some people. I'm also not against psychedelics for some people, in a controlled setting. However, I would say both are slippery slopes, and intermittent fasting is getting so much press. Everybody thinks they should do it, but it does lead to eating disorders. A lot of people can be triggered by intermittent fasting, so it's being careful with it.
How do you treat them? Do you treat them differently? The two?
Well, no, depending on the degree, it's if you have a full-blown eating disorder and you're anorexic and your BMI is below what's healthy, yes, I treat you differently in that you're probably going to have to go inpatient. You might die. But when
obviously, but the degree between, the degree between a disordered eating that just crossed over to, say, bulimia.
Yeah, I would approach them the same, challenging the mindset, helping a person realize, what's helping them and what's like not helping them. I tend to prefer a person have a lot more body awareness, stop eating when they're full, to doing something like intermittent fasting. I tend to help people realize what their triggers are. With bulimia in particular, hypnosis is actually quite effective, especially bulimia. It's such a heartfelt thing for me because people think of it as a teenage disorder, and yet people come to me and say, look, I've been bulimic for literally 40 years. And their husbands don't know, their friends don't know, even their other therapists don't know. It's become such an ingrained part of their lives, and they're so good at hiding it. And really using hypnosis to say, I'm ready to stop, and really getting in touch with that part of them that doesn't want to be doing anymore, I think could be very profound. That being said, if it's a certain point at which you're bulimic and it's dangerous, even once-a-week therapy isn't enough. You could have somebody who binges and purges 5 times a day.
Right, and also, does hypnosis try to address underlying trauma?
We don't use hypnosis for underlying trauma. We would use it for relaxation. I'm a big proponent of EMDR for trauma. There's a lot. I actually have 2 separate practices. One's a hypnosis practice and one's an EMDR practice. I'm the owner of both, but I don't practice EMDR. My other therapists practice EMDR. EMDR is amazing for emotional eating. Or sometimes what you could do is, if a person does both hypnosis and EMDR, you could get some of the symptoms under control with hypnosis to a point that they're kind of tolerable, and then move into EMDR to address the underlying trauma, to make sure, because hypnosis on its own could be short-lived if you don't address the underlying things. So even when we do hypnosis, we generally do hypnosis and then we're doing other forms of therapy. The nice thing about hypnosis is, say you're doing something like psychoanalysis, you might not start to feel better for a year, but it might make you better forever. Now, a lot of people can't tolerate that year. So if you start out with hypnosis and you start to feel relief while you're working at the long-term underlying changes, it can just be extremely impactful. there's the buy-in. People see results right away. But the hard thing is helping a person understand, yes, you saw results right away, but if we don't make these permanent changes, they're just going to come back. People like quitting smoking, for instance. People come in once, never address their underlying anxiety or whatever they're going through, and then come back a month later and say, oh, the hypnosis must have worn off. Right. And they'll say, whereas I look at that as you started smoking again for the same reasons that you're smoking in the first place, because you haven't developed any other tools to deal with your anxiety.
Right. It's, I mean, speaking of EMDR, because so originally when we were talking about me coming on, Dimitri was like, oh, Dr. Lavelle does EMDR. And I'm like, are you sure? I think she does hypnosis. Hypnosis and EMDR are different.
I don't personally do that EMDR. It's, but I support that the story behind that is I was so blown away by the work that my colleagues were doing, that when they came and said, we really want to be doing EMDR, I'm like, you know what? I'll support you in that. So now I support the colleagues in my practice who do hypnosis, and I've always done hypnosis, but I help them build a whole structure so that they could practice EMDR. So I'm on the sidelines, like rooting them on and, kind of championing the practice, but they're the ones practicing EMDR. I'm personally a big fan of EMDR.
Right. And one of the, because I'm EMDR trained. I use it in my practice. And, one of the things that you said, like, you mentioned like Edison, let's say, was like holding a ball and right. And doing an invention that's like a dual awareness, which kind of an EMDR, that's exactly what it is, right?
There's
it's
a lot
kind
of
having
overlap.
that dual. Yeah.
Yeah. There's a lot of overlap with the EMDR and the hypnosis, I think.
Yeah.
How does hypnosis help with ADHD and specifically infertility? I saw that on your website too. How can hypnosis possibly help infertility? ADHD, I could see that, but infertility?
Well, you got to remember, like, we are integrative therapists. We're not doing hypnosis even the entire session, and we're not doing hypnosis for some of the session. Okay, so with ADHD, I do think the hypnosis directly can help the ADHD. Because like she said, all hypnosis is self-hypnosis. And think about this, a person with ADHD, they're told to get breaks more often so they can run around. But really what they need is a moment where their mind can run around. And hypnosis can be extremely relieving for a person with ADHD because your mind might have 10 songs at once going on in your mind. And it's this break that you're just hearing one. And I mean that as more of a metaphor. And it's like, wow, okay, at least I got a moment of kind of clarity and I got like an escape from my mind. And then the more you teach them self-hypnosis, the more they can learn to use these tools to focus it sometimes and then let their mind wander. So hypnosis itself directly is very helpful for ADHD. As you're then also doing CBT and coaching and other things for ADHD.
And how would someone get into like that hypnotic, like, right? Like how would someone do self-hypnosis? How would they get into this?
There are a lot of different techniques. A lot of times what you're going to do is you're going to do hypnosis, with them to them on several occasions. So they're used to that state. The technique that I like for self-hypnosis is doing a visualization where they start with like a calm place, right? Say somebody visualizes being on a beach. And they learn to practice, like taking a full 2 minutes and picturing every site involved in, like what the beach looks like, the color of the sand. Are they small grains of sand? Are they large grains of sand? What color is the water? What color is the ocean? Like what color, and after 2 minutes of getting that in their mind, adding, now you're going to hear in the mind's ear, are there seagulls? Is there a breeze? Is it the sound of nothing? And you're trying to hold the sounds in your mind at the same time as the sights in your mind. Then you're adding touch. Then you're adding smell. And you're getting them used to getting so focused that it naturally becomes, it's training their mind in a way. And that can be very helpful for ADHD.
And for infertility?
Okay. So for infertility, I would say we're mostly focused on the therapy around it. and being fertility informed therapists. Now, understanding the process, helping people navigate it. However, people end up having a lot of magical beliefs around infertility. People don't realize how stressful it is. So, we're going to be using, we're not using hypnosis to help you get pregnant, and by no means. And I wouldn't even state the idea that if you lower your anxiety, you're more likely to get pregnant, because I think then people focus on too much, like, oh, it's my fault because I was too anxious, but we can help the process, helping a person get into a hypnotic state when they're getting a retrieval and they're nervous, or getting their blood drawn, or having to go in, it's very anxiety provoking. Helping a person stop their thoughts of visualizing a horrible future if they can't ever conceive naturally, or if they decide they're going to have a different route. Helping them get in touch with, like maybe a person's debating, do I want to, hey, I've just been told this horrible news that I can't use my own eggs. How am I going to feel? Like, help visualizing, how am I going to feel if I get donor eggs? How am I going to feel if I decide to adopt? How am I going to feel if my partner and I decide we want a different kind of life? And helping them use hypnosis to get this place of real clarity as to what kind of course they want to take, because everybody's brought up the idea that when you're just ready, you're just going to have a baby. You and your partner are going to have no problems, and it's just going to happen. And then it doesn't, and there are a lot of different ways to slice it, and a lot of different decisions. So we're using hypnosis as a way to calm anxiety and help you get in touch with how you're feeling, and for kind of positive thinking as well, that you're going to be okay regardless of the outcome.
Right.
Right. I want to get you out on this last question. I want to talk about your dissertation. What did you find in your research on the psychology of making decisions on staying or leaving after betrayal?
Yeah, it's really interesting. We correlated it with narcissism and attachment style, right? So, surprisingly, narcissists are the most open to infidelity when it's them, but the most angry when it happens to them. Right? But what was very interesting is the attachment style. So a person with an avoidant attachment, so a healthy attachment style, tends to find a minor betrayal. It's hard, but they stick with it, right? A large betrayal.
Which one is avoided?
No, healthy.
Okay.
Healthy attachment style would forgive a minor betrayal, work on their relationship and sort through it. But a larger, like where the person wasn't willing to change, they'd walk away, right? What you found with anxious attachment style is the more they're cheated on, the more they actually cling to their partners. So they're actually less likely to forget, like less likely to leave a relationship if there's infidelity than if it never happened at all. Because it brings up that like abandonment trauma. And then avoidant attachment, they're kind of like, it could be like, hey, I looked at somebody. Your partner looked at somebody, you're like, yeah, let's just not be together anymore, right?
Right. Oh, that's really interesting.
Oh, okay.
Yeah, because I just finished reading State of Affairs.
Oh, cool.
By Esther Perel, yeah. And so I think this idea of what happens after betrayal, and I don't think she spoke a lot about attachment styles or different personalities, but this just adds a component of like how different people will respond. And
so how do you deal with that in therapy then, if a couple comes to you? Do you do couples therapy at all?
I don't. I do couples therapy. It's not one of them. I don't do it as much as other things, but I actually really enjoy working with couples. You're helping a person analyze, their own feelings towards it. Also, infidelity is defined by the rules of the relationship, right? So if you're in an open relationship, that's not cheating. And it's like, you think about how much your partner's behavior deviated from your implied contract within your relationship, right? Some people would consider porn cheating. Some people would consider, you can have an ongoing affair, or you could have casual sex, but as long as you don't develop a relationship. There's, how much did it deviate from the rules of your relationship? And how willing do you think your partner is to change? Looking at all the dynamics of, were you unconsciously pushing your partner away? Did you want to leave anyways? Is this a person has a pattern that you overlooked because you wanted to be loved? You're going to examine a lot of things. And again, you're helping a person get into, more in touch with what they really need. A lot of times it's cloudy.
Sure. And when those attachment styles get brought up, do couples, do they maybe start looking at the situation differently? Would that insight be helpful?
Absolutely. Right. To understand, you might be clinging to your partner because you're, because something happened in your childhood and you have an anxious attachment, as opposed to thinking, well, I'm just a very forgiving person, or I really love this person. It could start to create those more dramatic shifts in understanding things for what they really are.
Right. And in some cases, right, it would lead to different outcomes, but probably more in an authentic way. Okay, now I understand, I can make a better decision.
Yeah, absolutely.
Right.
This was great. I really appreciate you coming on here. Thank you very much.
Yeah, thank you so much for having me. Great questions. Really interesting.
Tell everyone where they can find you and how they can find you.
Yeah, so I'm Dr. Sera Lavelle. I own 2 practices in New York City. That's New York HYPNOSIS and Integrative Therapy, and Soho Integrative EMDR. And then we didn't get a chance to talk about it, but what I'm really the most excited about in this next year is launching my app, Via Better Eating, which uses a lot of these principles through app form to help you reevaluate your relationship. It's not weight loss. Sometimes, developing healthier habits can lead to weight loss. However, that's not the goal. And actually being able to launch something that would truly help people have a better approach to eating is something I'm very excited about, because I do see what's currently on the market, for the most part, there are exceptions, as being pretty toxic.
Okay. Well, we're going to have you back to talk about the eating issues.
Well,
didn't let me
love
get
that.
to that
Sorry. Because you love apps. Go ahead.
Thank you for letting me speak on my podcast. All
right, go.
I appreciate that. We will be making an appointment with you later after the show.
Okay. Yeah,
actually, I do love apps. I had an app for 2 years that didn't make it, which is why now I'm doing a podcast and have a private practice. But I do want to probably have you back to talk about apps, technology, and eating, because there are a ton of eating apps and food apps that there's a crap ton of intermittent fasting apps out there.
Oh yeah, absolutely.
And there's a bunch of weight loss apps out there. So I think that would be a great podcast
to see
topic,
how this is
see
different,
how your
and
app is different and why it would
how
be
it's
better.
effective.
This would be a great new topic. So we're gonna have to schedule that.
Okay. Cool. I would love to.
And then when is your app coming out?
We're aiming for the end of this month, might be June.
Wow. Okay.
It'll be the first launch, so it won't have all the bells and whistles that we want. However, it's going to be something you can talk to at any time. That's going to really challenge your thinking around.
Okay, so we'll have to schedule that as your MVP comes out, and then the first few months, and see how it does. All right.
Yeah.
Thank you. And we'll see you soon then, definitely.
All right. See you soon.
All right.
Bye.
Bye.